Hello, everyone. Welcome to GADA's webinar entitled Building Bridges. We are very pleased to have Gretchen MacCarrick, Genetic Counsellor, here to talk about navigating mental health with aortic disease. So I'm just going to start by reading our disclaimer. The information in particular, the medical and scientific information contained in this virtual event is provided with the understanding that the program is provided by a voluntary health organization and is not engaged in rendering medical advice or recommendations on diagnosis or treatment of any aortic disease or genetic aortic disorder. The contents of this webinar, such as presentations, discussion, text, graphics, images, and other materials are for educational and information purposes only and as a benefit and service to the furtherance of GADA Canada. Genetic aortic disorders are complex and multisystemic that can only be properly diagnosed and managed by a skilled and trained healthcare professional. The manifestations and severities of these disorders vary greatly among individuals and require personalized medical management. None of the medications, courses of treatment, or lifestyle and activity recommendations discussed in this virtual event or on the GADA Canada website should replace necessary consultations with qualified healthcare professionals. GADA Canada, or the Genetic Aortic Disorders Association of Canada, is a registered patient advocacy organization promoting research-based awareness, education, and support to patients with genetic aortic disorders. We are dedicated to saving lives and enabling a promising future for individuals living with genetic aortic disorders, including Marfan syndrome. Co-founded by GADA, MAC, or the Montalcino Aortic Consortium, is an international research collaborative of multidisciplinary clinicians collecting patient data to generate gene and variant-specific risk models for personalized medicine to improve the outcomes of individuals with genetic aortic disease. And I would like to thank the Thematic Foundation, who is a funder of GADA. All right. So it's my pleasure again to introduce Gretchen. She is an assistant professor at the McKusick-Nathans Department of Genetic Medicine at the Johns Hopkins University, where she's the co-director of the Cardiovascular Connective Tissue Disease Clinic. She has extensive experience with mental health and other support topics for the aortic disease population through her involvement in an advisory capacity for the Marfan and Loeys-Dietz syndrome foundations. Without further ado, I will pass it over to Gretchen.
Thank you, Andrea. I'm just gonna,
Okay.
once you come down, I'll put my slides up. It's so good to be here with everyone tonight. Rescheduled, I think, or just pushed back a little bit from earlier this fall. So I know as a speaker, we're never supposed to start with like disclaimers, but I have a few. So one, I will say that my mother passed away this weekend. And so if I need to take a moment as we're going through some of these heavy topics to like take a breath and do some of our self-management, I hope you'll have patience with me. But I'm also very honored and excited to do this talk because I think in this moment of my life, I need to learn some of these lessons. And all of the lessons and themes we're going to talk about, even though we're going to talk in context of connective tissue disorders and aortic dissections, etc., are really like life lessons for all of us in just life situations. So second disclaimer, I leaned in really heavily to this bridge theme. So I wish I had a prize to give someone, but there is a Canadian bridge somewhere in this talk. So I don't think you can chat, but in the Q&A, if you can point out which one it is, you get my total kudos. And then third disclaimer or third recommendation, I'm super happy that GADA is putting this on and continuing to recognize the importance of mental health and kind of psychosocial issues in our population. So if you have any ideas, resources, want to get involved, or helpful things that you would like to reach out to GADA, again, please put that in that Q&A, because I think as a community, you know, the more resources and education we can put together, we just lift each other up as a community. So we're going to talk about navigating mental health with living with an aortic disease. Let me make sure I can move my thing forward. Okay. So, you know, I'm sure we have a combination of people in this talk of people who've had, you know, aortic events, a surgery, a dissection, or even parents kind of navigating having a child or a spouse. And I think you all probably recall that moment when your body or your mind is really shaken, right? When you get that phone call with a diagnosis, when you've had that dissection or rupture happen, or when you've had that surgery and you're kind of post-surgery kind of dealing with like what's the next part. And this is really kind of like a rocky bridge, right? Like you kind of have uncertain steps moving forward, and it really takes resilience and trust in yourself and your support groups to kind of start to take those steps forward to like a rock or a more stable ground. And so where this topic kind of, or this reframe of mental health, the bridges, came about is that we were at the Marfan Foundation conference this summer and leading a post-dissection group. And we usually talk about like learning to trust your body after a dissection. And this gentleman reached out in the session and was like, I don't think that's true. It's learning to live with an untrustworthy body. And I just thought that distinction was so beautiful and so important. And in fact, so did one of my colleagues. You might know Ryan Rodimer. He is the VEDS movement director in the US under the Marfan Foundation. And he wrote a really beautiful essay that kind of addressed this distinction. You can find it if you friend him on LinkedIn. And he had this really nice quote that says, the journey since then, since his aortic dissection, has been about learning to coexist with an inherently unpredictable body. It doesn't follow the standard rules. It has its own logic, its own timeline, and its own way of presenting problems that don't fit neatly into a medical textbook. And I am probably 100% sure that most people living with an aneurysm or dissection, aortopathy, gene variant kind of feels this way, both internally and probably when they're presenting to their physicians for advice and medical management. How many of you have gotten that, that's interesting, I don't know about that. And we do know that, living in a body that is perceived as untrustworthy is clearly going to impact mental health. And there are a few studies, not a lot, but a few studies in patients with various aortopathies, aortic dissections, aortic surgeries that shows in this population approximately about a 30% rate or so of anxiety and depression. Similarly, about a third of patients can go on to show at least one symptom of post-traumatic stress disorder. So we're going to touch on these kind of topics. And then we're also going to talk through prolonged or complicated grief, and then survivor's guilt and vicarious trauma as kind of large contexts and emotions that can come up living in aortopathy community. Let's see. Okay, so first off, anxiety. So anxiety is an emotion characterized by feelings of tension, worried thoughts, and also physical changes, right? So I have high functioning anxiety, and I know that when I get anxiety, it mimics kind of the heart features that a lot of aortic patients kind of describe and get scared about, right? You get kind of a rapid heartbeat, you can get symptoms of sweating and dizziness that can really cause this cycle of like the mind and the heart kind of feeding upon each other. And I think anxiety in itself is not a bad thing, right? It helps prepare us for conflict, for attacks or things that might be coming on a very basic line. But if it really incapacitates you and doesn't allow you to move forward in life and in conquering things, it can be quite debilitating. And that's kind of the anxiety we're talking about, more so than being anxious over a test, but really like this deep feeling of anxiety. And a lot of people clearly are going to show anxiety over aortic surgery. A lot of times you can kind of put your diagnosis away from the top of your brain, but when you go in for your scans or your yearly evaluations, that's when kind of that anxiety creeps up. There's clearly anxiety over, how your disorder can impact how you're able to function as a job. Will you have a job after surgery? Can you still do the lifting? How is this going to impact your family, and worrying about how your kids are going to react, or your spouse? Over socialization, pretty much everything in a life can be impacted by this diagnosis. And again, a lot of times, especially after a dissection, as you're living in that untrustworthy body, you have to figure out like what is a medical emergency or what is something different versus just kind of a normal ache or pain. And that can be very, very anxiety provoking. And then we have depression. And again, some of these are just feelings like we're all going to have, right? We all go through really sad, terrible situations in our family, in our life. But depression is really this not only feeling of sadness, but really a loss of interest in normal daily living or things that brought you happiness or joy before, where you really are losing engagement with your life. And, depression, you can be depressed for a day or two and kind of get over it and, talk yourself up, pick you up by your bootstraps. But depression is kind of like a sitting in that place for a longer period of time. And I think there's, again, a lot of reasons why people can feel depression in the aortic space. Sometimes, gosh, a lot of people's kind of antidote to depression or anxiety is exercising. And after you've had a dissection or after a diagnosis, maybe your ability to exercise like you used to is no longer the same. And that can be a really debilitating kind of concept to come to terms with. Clearly, you can feel depressed over the uncertainty that your future or that your perceived kind of uncertainty over your future. And again, these same issues about how this impacts kind of the communities around you. And also just depression over like, gosh, my life is so much different than others, or my life is different now. I wish I didn't have so much going to the hospital and the doctor all the time and all of this pain. And that can kind of really sink you into these ill feelings. A word about medical trauma. So trauma is typically or post-traumatic stress disorder, those type of things are typically related to like weather events or hostage events or, crime, trauma, etc. But we do know that trauma can also come from the medical setting. And it might be with like a specific event, but it can even be more subtle than that, where there can be some trauma associated with kind of distressing events, kind of chronic pain, or even feeling like dismissed with medical treatment. And we do know that there is a link between trauma and PTSD and kind of a layer of chronic illness. So, especially in the connective tissue population where there might be underlying pain or GI symptoms because of the hypermobility and the connective tissue, we do know that kind of living with this baseline trauma and depression can add a layer of GI, musculoskeletal, pulmonary kind of brain fog issues on top of that, which can be really hard to tease apart. And then often people describe like a trauma trigger, right? Like if you had a dissection and going back to that same hospital, you might tend to avoid it, or it causes you a lot of anxiety or anger. Some people describe even like having ambulances and the noise going by, or certain smells that they experienced at the Chinese restaurant when they had their dissection. All of those can be very subtle things that can like bring up this anxiety and trauma in someone post-event, many, months or years later. And so kind of thinking through, if you're starting to have an anxious event, thinking through like what actually is triggering this? Is it something from my medical past? And a lot of people say, they can have trauma symptoms or things that trigger them, but might not actually fit like all of the criteria for post-traumatic stress disorder or medical PTSD. Officially, medical PTSD usually begins about 3 months after exposure to that traumatic event. And those symptoms usually last longer. They can be quite ongoing, and you can have that trigger like every single time for months and years. And some of the symptoms or the responses of your body to like the trigger can be re-experiencing that event. So if your mind is getting stuck in that loop of the the ambulance ride or the surgeon talking to you or things like that. That can be really intrusive thoughts that can happen when you're awake or even when you're sleeping. So people tend to try to avoid those sounds, those noises, those smells that trigger them. There can also clearly be cognitive and mood symptoms, again, like the depression or anxiety. And some people kind of also have these arousal symptoms. So you feel like you're really on edge and you're just like listening for every sound and you just feel like you're kind of walking on that edge constantly, which can be really, really exhausting, truthfully. You know, another topic that can come up in the aortic disease space is vicarious or secondary trauma or survival's guilt. And again, we usually think about these in terms of like massive disasters or events or in kind of the police or ambulance, emergency responder type realm. But I actually think it's pretty appropriate for when we're living in like a support group advocacy type community, because you hear everyone's stories and you can hear the good and the bad and the ugly, and you can really connect with people who have a story similar to yours, or you might really connect to someone who is of the same age or the same sex or has the same kind of family dynamics, and you can kind of transfer your experience, their experience back to you. So I think this can really cause some like traumatic stress from being in community, and grieving community, but doing it in a safe way is really, really important. Something I've been really learning about and kind of, I guess a good lesson is kind of learning the difference between anxiety and grief. And anxiety, I feel like, is something that can be kind of maladaptive. It is good, but if you're sitting anxiety, if you're in the what ifs with the intrusive thoughts coming in that are debilitating you, sitting in that anxiety space, can be maladaptive. But grief is a little bit different. Grief is a very natural emotion, and grief is, you can grieve over a loved one's death. You can grieve over the loss of the life that you thought you were going to live. And healthy grief is very normal. And healthy grief can also cause you to be fatigued and tired. It can also bring very positive things of like strengthening and figuring out kind of a purpose and what is important for you. And so all I say is, like, if you are getting the heartbeat and you're really kind of feeling that chest pain and things like that, spend some time like examining yourself. And is this grief? Is it sadness? Is it anxiety? And being able to sit in grief and kind of recognizing it as like, oh, my body is in grief and a little bit of shutdown mode because of grief. I think, the answer there is that you just have to kind of sit in that space. But there can be prolonged grief disorder. So this is kind of the extreme of grief when it becomes unhealthy. So this grief is very intense. You feel like alone. You want to shut down yourself. You kind of ignore the things that brought you joy and life. And you experience just like an incredible emotional response. And so if you're sitting in this prolonged grief for like months, weeks, this is where, the grief becomes unhealthy, and we really need to seek some more psychosocial support for that. So some of what I'd like to talk about kind of, transferring to like, okay, we have all these negative emotions and feelings. What do we do about it? Like, how do we kind of work on our mental health and kind of flip that switch? And kind of going along with like a bridge and how we take care of a bridge, right? It really is, we need to switch our way about thinking and acting. We know that the medications that you're on, the lifestyle changes, this chronic management, the scans, just living in this kind of hypermobile body has a really big mental toll, and what we need to think about is all of that stuff, though, even though we want to frame it as like a negative and it's really unfair and not everyone has to do this, we need to kind of flip that switch and think of it as like, you know what? Just going to have a maintenance contract with myself and think of this differently. It's not negative. It's not woe is me. It is, I am doing the ongoing maintenance and repairs that I need, that my body needs to really live this life and to really have self-compassion with that. Whoops. Thinking about it instead of the negative way of like the positive way of like, I am carefully maintaining myself. I am worth it. This is just what I have to do. And kind of like de-emotionalizing it almost. And I think this is the same way. There was a really good question that came up about like not being Pollyanna, right? About like, oh, I had that surgery and now everything is fine and everything is good and everything is fine. It's the same kind of, that's the positive spin on it, but it's probably a little denial as well. It's just this careful maintenance that we need to do with our bodies. And again, it's kind of trite to say, but really scars are a sign of survival and strength and not weakness. And thinking of that aortic surgery or the emergency aortic dissection is like, again, I'm not replacing it and everything is fine and I'm going to get back to who I was and what my body was. But you know what? I am reinforcing. I am making stronger. I am doing all the things that I need to do. Just kind of that mental switch can be, I think, very helpful. And also remembering that on this bridge, people feel very isolated. They can feel very alone, feeling like no one does understand. But people, they might not live in your shoes. They might not 100% understand. But I think we have to generally believe that people want to be helpful, that people want to understand, that they want to provide support, but that we all like sometimes put our feet in our mouth and say the wrong words and don't know how to be helpful. So we overhelp or we underhelp or we remove ourselves. And so just knowing that like, if you have a need, please just say it. I've been working through therapy a lot of like, gosh, we have these expectations of people, right? But unless we say what they are, they might not be on the same wavelength as we are. They won't know our perceptions, our expectations of what we want from them. So if there is someone who is annoying you with their responses, or someone who is like, how can I help? Be like, I don't know how you can help, but like, I need groceries, or just things like that to like speak what your needs are. And just remember that support for everyone looks different. There's not one way to get the support that you need or build that community. It can look many different ways. I will say, for some people thinking about kind of these actionable coping strategies of how can we get there, we'll talk about a lot of this. And, again, if you haven't had exposure to these things or someone has suggested them, you might be blowing them off and being like, oh, right, like tapping, breathing, all of these things. But I really think they do work. And sometimes it isn't a one size fits all. You have to figure out what works from you. We'll go through some breathing exercises and I'll kind of tell you like what works, what doesn't work for me. But when you're in that moment of anxiety, there are some skills that are very helpful. Just kind of deregulate your nervous system to kind of bring you back to the present and bring you back to like not that heightened anxiety state. And these things, again, are breathing exercises. There's some tapping exercises that have to do with very like kind of gentle tapping just to kind of get you in the present and reset. Clearly exercise, stretching, kind of feeling your body can bring you back to the present as well. And there are a lot of people who either very short term or long term might need more assistance. And there might be additional like therapeutic options that you need. Kind of the two biggest in this space that I would think about would be cognitive behavioral therapy, or CBT. And then for people who really have like intense trauma symptoms, there can be kind of a psychiatric intervention that has to do with eye movement desensitization and reprocessing, where you kind of, a therapist or a psychiatrist walks you through the experience again and again, and with these rapid eye movements that kind of de-stress that in your brain. And I think there's a lot of things that you can just experiment with. You know, some people, we've kind of gotten out of the experience of journaling and writing or writing letters, you know, but I think that's really powerful that sometimes, you know, all of our thoughts get jumbled in our brain, and being able to write them down and then either like burning them, keeping them in the journal, like there can be very much some therapeutic practices. Again, gratitude practices, whether you're speaking them out loud or talking about them and bringing the focus from like the unknown and uncertainty and badness to like the fullness and richness of your life, can be really helpful. Again, things like getting out into nature and movement can be very, very helpful for strategies to reduce anxiety and depression. So a few exercises or things that I like to do that I found to be super helpful for myself. And is that we'll talk about that. And really what we're trying to do is kind of reset our nervous system. And I will say that this is very much can be related to like medical health and stress over that. But I think I will just say in today's time and the uncertainty, I think we all just live with this baseline anxiety from the world and everything that's going on. And I think we're all kind of living in this baseline fight or flight mode right now, like waiting when that CNN buzzer goes off of what's the latest news or what's going to happen. So I think we're all kind of living in that baseline fight or flight mode. But then when you have a medical condition, that is kind of another layer of fight or flight. And I would just say, you know, there's been some evolution of fight or flight. And when I say fight or flight, this is like how we deal with adversity or conflict or like a perceived danger. You know, it used to be thought that we would like attack it and we would kind of get in its face, or flight is like we just run away from the situation. So you just might avoid going to the medical professional, you might avoid getting the scans. But there's kind of more reactions now that we can have towards those uncomfortable or those really challenging situations. I'm a personal fan of freeze, where I just go into like shut down mode and you just kind of hibernate within yourself. And then there's also the kind of the fawn reaction, is where you try to be kind of adoring or, you know, really positive to that person who is bringing conflict or that thing is being conflict, so that they won't like bring that bad news to you. And so I think we're all kind of sitting on that baseline right now. And what we really want to do is try to calm down our vagus nerve, which brings us from the sympathetic nervous system and that baseline anxiety being in control, to the parasympathetic nervous system kind of being in control. And this is our baseline rest and digest, where we're feeling good and comfortable. And this is where we really want to be living. And so this is where breathing comes into play, because breathing, deep breathing, is a really great exercise to kind of reset that vagus nerve and bring us into the parasympathetic nervous system leading the show. I will say for me, you know, you've probably, a lot of you have heard of like in for 8 seconds, out for 4, or vice versa, or like the 4-second square thing. I find that really stressful, to be honest with you, because I find myself saying like, oh my gosh, I can't breathe out or breathe in for those 4 seconds. Is there something wrong with my lungs? And like, I start spiraling that way, probably like you spiral with your heart. And so some breathing techniques that I really like, that I have found helpful to kind of reset that, is one, just taking a deep breath. And then when you're like a slow deep breath, and when you're at that top of the breath, just 1 little second more intake and then output. And that can help reset your vagus nerve. One of my favorite things to do though, is that you can just do it just when you're sitting at your desk. You know, you can do it when you're lying in bed. We tend to want to just like put your arms behind your head and look forward. And then by simply kind of taking your eyes and shifting your eyes to the right and just looking to the right and normally breathing deep breaths with those eyes to the right. And then you just repeat it on the left side. And this exercise resets your vagus nerve. And oftentimes, if you know that you're resetting your vagus nerve, you'll experience like a big swallow, a big yawn, a big sigh. And so you know if you're having that kind of reaction, you're kind of resetting yourself to that rest and digest and being at a more peaceful place. But there's tons of exercises that you can look up. And again, there's not a one size fits all option, right? Like find the things that help you. You know, for those of you who might be a spouse or a friend or a parent or, you know, even affected and kind of thinking about what has been helpful or not helpful in your life, you know, things that are actually not helpful, you know, again, have grace and compassion with the people in your life. But we do know that there can be unhelpful responses that our peers, our family, our spouses might have. So maybe they just want avoid talking when you kind of would like to kind of rehash or talk about your feelings, but you might have family members that kind of shut it down, you know, for whatever reason. That can be unhelpful. People who minimize it of like, oh, you're out of the hospital in a week, you're fine, not a big deal. You know, religiousness, overly giving advice instead of just listening, and kind of giving misinformation through false identification or like, oh, this happened because of this. You know, those can be unhelpful responses. But again, this is the thing where I feel like you have to also take responsibility for your mental health and what are your needs from other people, right? Like sometimes you want a kick in the butt to get you motivated, to get you out of, you know, your freeze mode. And sometimes you just want empathy or sympathy or someone to listen to you. And so I tend to have some people in my life who give me the opposite thing that I want. And I'm learning to be like, I don't want an answer. I don't want you to fix it. I just want you to like sit here with me and listen to my story. Or sometimes I'm like, gosh, I'm super anxious about this and I don't know why. Can you like listen to my story and try to help me figure out like what is driving that? So really being able to communicate as much as you can your needs. And again, I know this whole concept of like self-care can sound really like froofy and like new agey, etc. But you know, self-care isn't just like manis and petties and like a nice massage. It really is taking care of what you need to be a functional human being. And those are physical things, those are emotional things, those are setting boundaries, those are like watching how much you're on social media. It can be, you know, thinking about your space and your financial needs and decreasing clutter that, you know, maybe brings a little bit of chaos to your life. It's engaging in personal activities that bring you joy, whether that's exercise or hobbies. It's actually also like medical adherence, you know, and making sure that you are on top of your things and not avoiding things. That's a really great way to self-care, making sure you're seeing your PCP and you're up to date on your medications, etc. Self-care can also surround financial issues, being on top and not getting behind on bills, and like making sure that, you know, from work that you are setting boundaries and that you're taking your vacations. All of these really simple things that are kind of like normal adulting tasks that some of us do not do very well, but we should try to make progress in because they're really great ways to like show ourselves self-care and self-compassion. And I do want to acknowledge that, you know, we talk about going to therapy and we talk about getting on meds if you need them and all of these different techniques, like it's super easy and everyone can have access. And I just acknowledge that that isn't always the case. There are a lot of barriers. You know, there was a good question there I loved on your, you guys are so smart. Your questions that you sent in are really, really top notch. And there was a question there about like, why don't providers ask about this? And I don't know. My like pie in the sky dream would be that every aortic surgery, dissection, surgical visit, even in like cardiology visits, like this would be part of the offering of like, you know, like cancer you go in and you get all of these services wrapped around. And I just envision the day where like our aortic patients would get access to, the cardiac rehab and the therapy and the pain management, like wrapped up in these services because they're so important. I do acknowledge there are financial barriers, hopefully, I guess in Canada, I honestly, I don't know the system. So Andrea, maybe you can give us more information, or I know GADA is really interested in kind of adapting some of the US resources to Canada when it comes to what is available, et cetera. But just to acknowledge that it can be pricey and that, not everyone has good resources where they're at. And so telemedicine and therapy is available, but it can be hard. Sometimes they don't do appointments in the evening, and so missing work. And just to say all of those things, I do say are logistical barriers. Andrew, did you want to say anything there, or I just saw you come up?
Yeah. Yeah, I think logistical barriers are the same, but unlike the US, we have a good chunk of our population that lives rural. So your surgeon may be, hours and hours away driving. And, what if you don't have a reliable vehicle or you can't afford gas? I mean, the surgery is covered, but getting to the surgery and trying to access aftercare, like it could be your closest cardiac rehab center, maybe 2 or 3 hours drive away, or the wait time to get in, maybe 6 months to a year. So those are some of the barriers we face. Distance, rural, and our healthcare system is quite overwhelmed at every level. So it's difficult to access services that you can either through the hospital or in your community. And then financial barriers come in if people are trying to pay for private services as well. So similar but different.
Yeah. Yeah, and all I can say is like keep fighting the good fight. I know we'll talk about a book that we have available, but I even found some like nonprofits. I don't know if they're global, but in the US, that if you're in an urgent situation or you meet certain like characteristics, there are options. So it might be take some creativity, but it can be very helpful. I still think there is a stigma about mental health. Either people think they shouldn't seek help themselves or from family members. And so really, I hopefully that has kind of decreased a little bit with COVID. And I know a lot of people kind of through that period and being isolated and having a lot of depression. Hopefully we are, as a community, are a little bit more welcoming of getting therapeutic help, but there can be that stigma. And then there can be other barriers, even though having aortic disease is kind of one layer or one block of maybe a small block or a big block of your identity, we have all these other pieces of identity, being part of an LGBTQ community, what ethnic or racial group, what language we speak, who do we culturally align with. And all of those things can be challenging when you want to find a counselor who is like
Mhm.
you, or, we get the question of like, I want a therapist who specializes in aortic disease
Mhm.
or Marfan syndrome or something specific, and trying to find a therapist who might, one, specialize in chronic illness, but two,
Mhm.
the most important thing is that you feel good about this person, that they show up for you in a way that is helpful to you, and that they're
Mhm.
willing to kind of learn about it. And I would always say that, many mental health, if they're worth anything, many
Mhm.
mental health specialists are there to really help you. And so if you want to allow your cardiology office or your nurse or your genetic counselor to talk to the therapist, to give them background information of like kind of what are some of the big topics we think
Mhm.
about living with aortic dissection or aortic disease, that communication can happen, so that you don't feel like you're constantly explaining yourself or your disorder to people.
Mhm. One thing that may be different, some of the larger Canadian hospitals will have social workers associated with their clinic. And so, social workers, if they're associated with your cardiac surgery clinic or your cardiologist, they may be able to provide short term mental health support. And they should be able to direct you to a group of psychologists or psychiatrists that we call health psychologists. So, they specialize in helping people adapt to a medical condition or a new diagnosis. So,
Well, thanks, Andrea. Um, So, a few years ago, my colleague Jennifer, who is a genetic counselor out of California, we got a grant from the John Ritter Foundation. And so we wrote this book. It's about 80 pages. It's Life with Aortic Disease, Caring for Your Mental Health, that kind of goes more into depth to all of these different things. It has some online resources, etc. I think GADA will link to it, but if you just Google John Ritter and mental health, you'll be able to find it. It's PDF available online, at different conferences, etc. We have a lot of hard copies at clinics and stuff like this, but you can always look into that. Just one resource that is available. And to kind of finish up my bridge analogy, I found these bridges that are called the wind-rain bridges. And, in China, there are, a lot of the businesses and kind of the farming happens along rivers. And so they have these beautiful wind-rain bridges that were like built generations ago to allow the different kind of communities to come together. And in these buildings, they have dedications to their ancestors. It's a place where people go when it is raining. It's a place where people go to pray, to have community, to have meals during the day, etc. And kind of it's not analogy, the translation of it is go ahead as planned, regardless of the weather or despite the rain and wind. And I just think that's like a really beautiful kind of analogy for life, but life with aortic disease too. Like the wind and the rain and the struggle might come, but please take your time to find that peace, find that prayer, find that community through these bridges. And I have to end because I am from Duluth, Minnesota, and we have the aerial lift bridge, which is a very famous bridge in Duluth, kind of, if any of you have been to Minnesota. And so I just wanted to share, this is my hometown bridge. So I just want to thank you, and I'm glad we have plenty of time. I can go through some of your questions, or if people have Q&As in the questions, happy to answer anything. I'm sorry that you couldn't chat and share resources and have that communication, but we look forward to any correspondence. And again, shout out to GADA for really making time and space for this topic.
Thank you, Gretchen. This is such an important part of not just aortic disease, but really everyone's life. We're all going to experience challenging situations, medical situations that are unexpected or even planned that are hard, challenging to cope with. And I really like your maintenance contract. I think that can be used for many things other than just healthcare, just in general. And it's also very important for everyone out there to remember to voice your concerns and your needs. Oftentimes we think people are understanding, but sometimes we're not. Your support person is not a mind reader. So very important to voice your needs.
Especially with your spouses, right? That is a good like marriage lesson to begin with too.
Yes. Please take out the carburetor. I may choke you in your sleep, right? So.
So I'll just answer that first question about the fainting. Yeah, I think that's part of the freeze response, right? That's probably an extreme. But yes, whenever like anxiety or conflict comes at us, fainting could always be on the table for that type of response to a stressful situation. And again, that's where like breathing and things come in. I'll give two other hints too. I'm trying to remember some of the questions that came in earlier. And one of them
I can read some of them if you want.
Well, the two other things I wanted to say. One is like, how do you actually like think about anxiety in the moment? And I can't remember the author who wrote a book about this, but I kind of like this tip and trick is like, recognize that it is anxiety, feel it, and then put it away. I think maybe this is a woman thing, maybe it's a man thing too, but like we tend to like circle and dwell and worst case scenario when we're in
Mhm.
that anxiety. Again, those what if she said this and then I said that
Mhm.
and then this happened and we get all angry. And so I think there's a very good tool of like, I am experiencing anxiety. I realize this. I can name my anxiety over this specific thing. I'm going to allow
Mhm.
myself to feel anxious for a minute. I'm going to breathe through it, and then I'm going to put it away. And so I think that can be one tool of just cognitively recognizing it and compartmentalizing it. Um, and then the other thing I was going to say too, another tool, like when you're in anxiety, and I think this sometimes can be helpful when you know that 3 a.m. wake up when your mind is like cycling and you're going crazy, is being able to, again, ground yourself in the present. So I know I have a dog that I sleep with, as well as my husband, but a dog. And so when I get that anxiety, I can be like, I am petting the dog. I am feeling the fur. I am hearing his snoring. So if you can like do 3 or 5 things that ground you in the present, of like 3 things that you can touch in the present, that you can hear, that you know, maybe not smell, but like you can feel in the present, that will get your mind out of that crazy cycling and kind of ground you to where you're at. So I just wanted to mention those 2 other kind of skills to like ground yourself from anxiety.
Thank you. Good skills. Great. Um, I think you've covered a lot of these, but I'm just going to read out some of the questions. So one of them is, how do I deal with the fact that this genetic condition that I'll be fine until the next time, and then till the next time, and then till the last time? So I think that speaks a lot to what you were saying about living in an untrustworthy body.
Yeah.
Yeah.
And I really think some of that is the maintenance contract, right? Like there's a lot of
Mhm.
uncertainty in life. There's an additional, like, huge layer of uncertainty when you have this untrustworthy body. But you kind of have to ground yourself in, like, I am doing everything I can that I have control over. I am
Yeah.
taking my medications. I am doing my daily walks. I am seeing my doctor. I am getting my scans. You know,
Mhm.
I can worry, but also I need to let other people worry about me and not worry until they tell me to worry. And so
Yeah.
I really think it is that contract of like, hopefully you're doing
Mhm.
everything that you can in this moment for this moment, and kind
Mhm.
of letting you just have to be you have to become comfortable with uncertainty, but you also just have to like ground yourself that you are doing everything that you can.
Yeah.
And if anyone has any other advice, please drop
Mhm.
it in the chat. But I think these are great
Okay.
questions.
One that I don't think you touched on was, for parents, how do you cope knowing maybe that you don't have this condition, but your children do? That is always a tough one.
Yeah,
Mm.
I think it is a super tough one. You know, in general, I will say outside of like extraordinary events, I used to work in the skeletal dysplasia world as well, then aortic disease. And a little person mom told me this advice, and she said, you know, it's always harder being the parent than the kid who has it. Because as parents, you come with your own history and your expectations and your like dreams of like, well, when I was 3 or 5 or 10 and on this sports team and I knew what life was like and I did all this stuff and that was my dream for my kid. Your kid is just living the life that they live, getting their scans on their medication. They don't have that comparison. And so it shouldn't relieve like all of this stress clearly, but I think it's a way of reframing of like, they aren't doing that comparison like you're doing. They're just living their life with a few different ways of living their life than your experience, but it's just their experience. And I just think, you know, again, uncertainty is hard. And it's really hard to think about a kid going into surgery or having an event. But also, you know, that is a part of life. And we need to kind of also come to terms with just the uncertainty of life.
Yeah. And don't forget to enjoy it, even though things
Yes.
may be uncertain.
Yes. No bubbles and, you know, And I think framing for your kids, and hopefully your doctors are also doing this, but like our expectation when we see a teenager or a kid and they ask us questions is like, yes, you should be planning for college and getting good grades. Yes, you should be able to take those trips and get married and have children, even though that might look a little different. And our goal is to keep you around and be here till you're 90 with great grandchildren and like all of those things. And that's the lesson and that we want to be imparting to our young kids. And that's what we should be focusing on and helping them focus on.
Yeah, I agree. All right. So the next question was, I generally need to learn how to cope with so much uncertainty. So I think we've covered that.
I'm right there
How do
with you.
how do we continue to advocate for our mental health when doctors are making you feel dismissed, like you're making up symptoms of, for example, maybe chronic pain due to loose joints and so on?
Yeah, I think that's really hard, honestly. And the number one thing I think I have people cry about in my office is just the validation of chronic pain is real. There
Yes.
is no x-ray, there is no blood test, there is no titer that says because you have Marfan or connective tissue or you have adhesions and scar tissue because of surgeries and hernias and things like that. Like pain is real. And how I think you can be a good patient, though, is being very specific if you can. And I know a lot of hypermobility pain is migratory and kind of non-specific. But I
Mhm.
think a really good tool is to really, and we'll make some of these available or I can find some, like assess the pain in a functional way if you can.
Mhm.
To be like, my pain keeps me up at night. So I'm only getting 4 hours of sleep and then I feel like crap the whole next day. Or my
Mhm.
pain is keeping me from, being able to grocery shop. And it's this pain. And being as methodical and logical as you
Mhm.
can about that, I think makes a difference when you're presenting your pain to the medical
Mhm.
profession. Um, and also that list of like what makes it better, what makes it worse,
Mhm.
what are you doing to try to reduce the pain, etc.
Mhm.
So really being methodical about your descriptions and putting function to it, I think is a
Mhm.
really good tool.
Yeah. So how does it impact activities of daily living,
Yeah.
to paraphrase? Um, how do you stay sane when you find yourself on permanent disability at the peak of your career?
You need therapy. That is a very deep thing because I think it's a complete shift of your identity, right? Like it sounds like if you were very work focused and work oriented, and many of us are, when you can't do those
Mhm.
things, your identity is just like, who am I? What's important? How am I going to do this? And then those are really, really deep issues. But also, I would say, again, this is like the reframing of even though I can't do what I could do, what opportunities does this open up? Right? Like I am a dog foster and I just think like, gosh, if I had the opportunity to volunteer and walk dogs or do something else. And so it is this shift of identity. This is what happens in people who are athletes too, right? Like all of a
Yeah.
sudden they were one person and now they are a different person. And it's just going to take time, it's going to take effort, and it's going to take reframing. But
Mhm.
you'll get there. It's just reshifting your purpose and recalibrating your brain to be okay with that.
Yeah. So we have some questions in the Q&A. Um, any suggestions on what to do with a surgeon's post-op admission? You will not live a normal lifespan. Despite many years of ongoing survival, This is hanging over my head and never goes away. It follows me around like a second shadow.
I don't know. I'd just be like, how do they know? Like the lifespan for Marfan syndrome is now approaching normal. A lot of the data around some of these syndromes and aortic dissection is based on people not knowing that they have something. And a lot of there can be some severe mutations that cause childhood death. Their crystal ball doesn't work. My crystal ball doesn't work, right? The
Yeah,
expectation is you live life like you're going to be around till 90. And you know what? Some people won't and some people will. And so I would
yeah,
just pshaw at that surgeon and be like, that's ridiculous. Like, you don't know. Where's your
mm,
crystal ball? Sorry. That's how
yeah.
I would say. Andrea, if you have a different suggestion, you let me know.
That's pretty much how I think about those comments myself. So, um, I mean, and you work in healthcare long enough, there's always people breaking the mold and breaking the expectations one way or the other. So there's no one size fits all.
And I
Um,
mean, I don't want that to be like, oh, well, then what's the point? I'm not going to take medication. I'm not doing anything.
yeah.
Right? Like that's the maintenance contract. Like if I do
Mhm.
everything within my control, I'm gonna try to hit that 80 mark. And that's just how you
Yeah.
have to respond.
Yep. A really nice comment here from John. I have another aneurysm about 6 centimeters after surviving a 7.8 centimeter dissection. I found this to have been one of my greatest life gifts because it makes me appreciate and live life to the fullest. So, just what you're saying. It's all about perspective. Another surgery at this point is much too dangerous. So, I just appreciate every day. Thank you for sharing that, John.
Yeah. It is. It's about how we respond to adversity,
Mhm.
right? Like you can sit and dwell in it, or you can be like, what is my new purpose? How do I, and again, not Pollyannish, not like
Mhm.
in total denial, but like, how do I, and there's a term for this and I'm just not remembering it right now, but just flipping the script on its head and being like,
Yeah.
how am I going to make this not a Pollyanna
Mhm.
positive, but like, how am I going to find purpose in this new body, right?
Yeah. Yeah. About focusing on the things you can control
Yeah,
or that you do have control over. Maybe that's a better way to say that.
yeah.
Mm.
Love
Just
this.
some.
Everyone talks
Mhm.
about gratitude too, and I think that's
Yeah.
really important. And we don't do
Yeah.
that. We're so quick
Mhm.
to beat ourselves up and beat life up and beat everything up that
Mhm.
it is true. Like if you do that 3 to 5 things per day, your perspective will change of things that you're grateful for, or things that are just beautiful.
Yeah. We have another person who said, I try to remember the gratitude I feel for learning early on that life is unpredictable. I learned this in my 20s with my dissection, and now many of my friends are just learning it in their 40s. Yeah,
Yeah.
right. Um, so just some comments that we received prior to the webinar. Mental health is very much affected when you had a near-death experience and continually live with a dissection. So, when the thought of instantly dying comes to mind, what is the best way to remove that thought and come back into the present?
So I think that's a tough one, but I also don't know if that's related to I'm having a panic attack and feeling like I'm really doing it, or if it's unrelated to that. Because I think that's where some of the the breathing techniques, the cognition of this is an intrusive thought.
Mhm.
Right here in this moment, I'm grocery shopping and doing just fine. Let me take this
Mhm.
intrusive thought and shove it over here, or being
Yeah.
grounding yourself. So I think whatever tool in that toolbox speaks to you, that's what you need to do in those moments. It's an intrusive
Mhm.
thought. Those are the things
Yeah.
that you need to be what is real and what do I have control over? Yeah.
Yeah. Um, I'm not exactly sure what this person is asking. After my type A dissection, genetic testing confirms a hereditary aneurysm syndrome exists.
Mhm.
Can this be talked about? So I'm kind of wondering if the person is wondering how to talk to their family about it. So.
Yeah, I didn't know
Any
if that
thoughts
was,
around that?
I mean, it's hard, right? Because I don't know if this is where she was going with the question, but like people have their own unique reactions. And so I feel like you don't want to like be a Bible thumper and pound it over their head constantly and you need to do this, you need to do this, but you also want to be true to yourself and feel responsible to yourself. So I think if anyone is diagnosed, if it's a genetic test someone can get or they just need an echo, like working with your provider to have like a page letter that is like, dear family member, cousin, sister, brother, mom, dad,
Mhm.
like, here's the genetic test, here's what you're at risk for, or get an echo. And, giving them that type of information because then you can feel confident that regardless of how they take it, you have done due diligence. Because some people are going to stick their head in the sand and not want to deal with it. And some people, you know, are going to say, oh, that's nothing, or oh, that is not going to hit me till I'm 60 or whatever. But you just need to be, stand in truth.
Yeah, great. So we're almost at time. So any final thoughts before we wrap things up?
No, the one thing I would say is every month we have a meeting in our department, and our boss always says, don't suffer in silence. And I would just wish that for all of you. Like, I know living with a disorder is hard. I know just the state of the world is hard, but don't stuff it all down, be in isolation, not communicate it. There are people, paid or
Mhm.
family members or community or things like that, who their greatest desire is really to be there for you. So give them the opportunity, but you also have to be bold enough and brave enough to like take that step to communicate what you need.
Well, thank you, Gretchen. This has been a really informative webinar, and I feel like many of the things you talked about can be really used in like day-to-day living and not just coping with aortic disease. And especially considering everything you're going through personally, like our hearts go out to you in this time. So thank you.
Thank you.